Next, hold on. Kathy Hazlett, I'm the program director for the Fairfield Cares Community Coalition.
Good morning, Melissa McGarry, project director of TPOD Trumbull's Prevention Partnership.
Good morning, Chandra Ring, executive director of Wilton Youth Council.
Good morning, Ellen Brzezowski, program director for Greenwich Together.
Good morning. My name is Ariana Trotman from GBEP, the Greater Bridgeport Area Prevention Program, and I'm the Community Coalition Coordinator for our LPC and Teen Fathers Expansion.
Hi, I'm Ingrid Gillespie, Liberation Programs and the facilitator for the Stanford Local Prevention Council.
Hi, everyone. I'm Michelle Liss. I'm Liberation Programs Outreach Operations Manager.
Hi, everybody. I'm Michelle Lapis. I'm sitting in for Terry Drew for the City of Stanford Youth Services.
Hi, Michelle. I wasn't sure if somebody was coming on. Great to see you.
James Olson, Stratford Partnership for Youth and Families.
Hi, Maureen Aziel from New Canaan Cares and responsible for the LPC for New Canaan Coalition.
I'm Magda Scomal, and I'm from Interactive Educational Theater Invited. Thank you very much. Works very closely with schools, community groups, and James invited me. Thank you.
I think that's everyone.
Hi, I'm Margaret Watt. I'm sorry, I'm sick. Sorry, hard to talk. I work with the Norwalk Partnership and the Westport Prevention Coalition.
Thanks for joining today, Margaret. Okay, I believe that was everyone. Caitlin, did you go?
I wasn't sure if you wanted us to go, but hi, everyone. I'm Caitlin Comet. I'm a program coordinator at the Hub, and I oversee the local prevention council efforts and other different initiatives happening in the towns of Fairfield, Westport, Wilton, and Weston.
Great. Thank you.
Okay, sorry, I didn't go either. Oh, sorry. Sorry. Hi, everybody. I'm Victoria O'Neill. I'm also a program coordinator with the Hub. Sorry. Thank you.
Okay, now I think that was everyone. All right. So next on the agenda, I just had Salesforce and work plans. I just wanted to remind everyone to keep inputting their demographic forms on Salesforce. Keep in mind, I know we're kind of getting to the last stretch here to do activities. If your work plan has changed, please just update that and send an email over with the updated version. I'll be checking in again when it's a little closer towards June, but I don't want it to be, you know, last minute and everyone's rushing and going crazy. But just so far at the LPC check-ins, it looked like everything was going great. So I don't think there'll be too many problems. And then next, we'll just move into the updates portion of the agenda, starting with Caitlin and the CACs.
Okay, so CACs are going well. We are moving along with our goals and our membership as well. We had a successful legislative forum in January. End of January. We were talking about early identification and connection to resources for youth, case management and case coordination, sustainability for psychiatric beds and support staff, and then mental health in older adults. We also spoke with legislators about the importance of harm reduction and trauma-informed care. And then, of course, we talked about our CPN or Connecticut Prevention Network priorities. If you want information, the recording, our info brief, all of that is on our website. We do have a new advocacy page, so you can check that out there. In our March meeting, our CAC meeting, we discussed youth mental health and how we can get more involved with clients and consumers. We had a presentation from Connecting to Care on the AIMS tool, which is an online search tool for providers and community members or consumers to seek behavioral health services that are specifically in-home services, and they are working on that tool to expand it, which is really great. It was a fantastic tool. And then we had Kelly and Fred present on problem gambling awareness and resources and what they had been seeing in the past year. So we do have a lot of exciting planning happening behind the scenes. We have some potential partnerships coming up, and we have a lot of focus on client or consumer outreach to get more lived experience representation, but also just to expand what stakeholders are being represented at our meetings. So a lot of exciting things happening. If you're interested in getting involved or just receiving our emails, please email me. I'll add you to the CAC list. Thanks.
Awesome. Thank you, Caitlin. Next, I had Victoria to give a suicide update and RSAB.
All right, so good morning, everybody. Just a couple updates on my end. So Caitlin and I have actually very recently become youth mental health first aid instructors. So we're hoping to be able to offer that to the region and to specific organizations in the very near future. Another thing that we will be doing is the hub, in collaboration with all the other RBHAOs and regional suicide advisory boards, will be hosting a webinar surrounding the Columbia Suicide Severity Rating Scale. So that'll be great. We've done it last year. It will be very similar to the one we offered last year, but really great in terms of getting some more information and just training surrounding that kind of screening tool. So that will be on May 23rd. And it's similar to all the other events that we have, so you can just sign up on our website. We have also created a flyer with resources for victims and survivors of gun violence, just given some recent events. And unfortunately, I think that can be re-traumatizing to people. So I think it's important, and unfortunately, I think people may need that or benefit from that. So we created that flyer, and I think Daniela has it to share out with the minutes. We also have, and I know I have emailed and talked to most of you about this already, but we will be doing a mental health 988 kind of campaign throughout the region. So a lot of that is up already, but we have train platform ads, billboards, and geofencing ads. So the train ads are in Darien, Fairfield, Greenwich, South Norwalk, and Westport. So those, we don't know right now, or I don't know right now if they're on the north or southbound side, but as soon as I have that information, I will let you know. And then we also have 3 billboards, so 2 in Bridgeport and 1 in Stratford. And then just a little shout out to Daniela and Caitlin, because I'm super proud of these numbers, but last year for our QPR trainings, we held 62 QPR trainings and trained 1,342 people in QPR. So that's thanks to all of you for kind of raising awareness, spreading the word. So I thank you all. And again, my amazing co-trainers and trainers on the call, specifically Danielle and Caitlin. But we are still seeing a pretty high increase in the number of RSVPs for QPR. So I think that's really great because we're obviously getting more people trained. So thank you all. I think that's it. Oh, sorry, no, it's not. I left one more thing. I just got the finalized 2022 data in relation to suicide. So I will be updating our QPR slides, and I will send that out to all of the QPR trainers within the region. So just be expecting that with some updated data for 2022. And now I'm done. Thank you.
Victoria, can you send that out to all of us, the updated numbers? Because
Yeah,
even when
of
we do Narcan trainings, we include that. So that would be great. Thanks.
Yeah.
Kathy?
Yeah, Victoria, I'm interested in a youth QPR or a youth suicide training. Do you have information on a training for youth regarding suicide prevention?
So I know that the QPR is typically, we really want to target 18 and up. That's kind of like more of a requirement, but I have done it for 16 and up, but I typically like to have additional supports, resources. If we are doing it for people under 18, I think 16 is kind of like the cap. We don't like to do younger than that, but really just talking to, if it's during or through a school, just talking to those added supports within the school to make sure that they're aware and they can kind of back us up in terms of the support for that. but there's also Talk Saves Lives, which is not necessarily a certificate training or anything like that. But Talk Saves Lives is another kind of avenue or option, which is similar to QPR, but it doesn't go into as much of the conversational aspect that QPR really focuses on.
Just another comment on the updated on the suicide data, we can also insert that in our Narcan training slides.
Yeah, I'll be sure
That
to,
would be helpful.
I can send that to Daniela if you don't mind, Daniela, to include in the minutes then.
Absolutely.
Okay.
Margaret?
Thanks. Kathy, I just want to tell you, in Norwalk and Westport, we train juniors and seniors in QPR like during going into health classes. And it's really well received by the kids. I think a couple of factors that have made the schools willing to do it are that it is a certificate training. And, you know, we've edited it. We put the role play in the middle. We have I've added a video that's like a kid, a 16-year-old from Texas talking about how she intervened with her friend. But, you know, it's allowed to be done for 16 and up. And I think one thing the schools really like is that right now, you know, with the new emphasis on everyone having a capstone and everything else, they want kids to graduate with any certificates that they can put on their resume. And so QPR does offer that. But we make sure to have, there's an exit ticket the kids have to fill out ahead of time, letting us know, you know, if they need to talk to someone immediately. We have to give a warning in advance. The teen talk counselors know that we're going to be there. But actually in the semester end evaluations, it's come up in multiple cases as one of the most meaningful things during the semester. So I feel like it is a really valuable thing for teens versus Talk Saves Lives, because it's, you know, I mean, I've done Talk Saves Lives too, but it's just a presentation, right? It's just a slideshow, so it's not interactive.
Do you have, Margaret, do you have specific slides for youth that's different than what you show adults?
I mean, I use our data from, you know, because we have actual data. We asked about mental health and suicide in Norwalk. So we have data where we're able to say to them, this is what you guys said when you were in 7th grade or 9th grade. And then this is what you said this year. And so that's really impactful. But I also include you know, the Trevor Project LGBTQ youth survey from last year, some stuff like that.
Yeah. Thank you. I'll
Kathy,
follow up with you afterwards.
We've also done it at Wilton High School through the Hope Squad club that Wilton has, which I'd be happy to share more information on if you like. It's a smaller group of students, but it's students selected by their peers.
Can I jump in? Yeah, we also taught it at a Greenwich High School, but one of the things that we brought out is one of our liberation staff is actually a 988 text volunteer, and she came and really walked through what to expect, etc. And we found that part was also an additional meaningful piece, particularly for the teens. So.
Great. Well, thank you. Victoria, send those numbers over to me and all that, and I'll share it with everyone at large. Let's see. So Giovanna was next on the agenda. She'll be hopping on when she can. She's at Sacred Heart right now. So I'm gonna move it over to Ingrid, who will be giving us a problem gambling update.
Okay. Daniela, do you have the website up?
Yep.
Webpage. So we're just gonna, it's been busy with regional gambling. I think one of the biggest news is that the hub did receive additional funding, so they'll be able to hire full-time, and they're in the present process of advertising and screening for that. So our next regional gambling awareness meeting, our last one for this fiscal year, and if you can make it, it would be great, is going to be Tuesday, June 11th from 12 to 1:30. And we're going to have it in person at Burroughs, and we're going to have the new Responsible Play van come down. And so we'd love to invite, we'll send out an invite, but please mark that on your date. And you know, it'll be lunch provided. The van will be there. You'll get to meet the new coordinator and all of the other gambling awareness resources. So it will be an in-person meeting that time. And I don't think it'll be the whole hour and a half, but we will have it from 12 to 1:30. So legislatively, we're following a couple of bills. One of them is financial literacy, mandating that. Right now, they're looking at what the cost would be to do that. And then there's another bill that was about directly forbidding colleges from, or forbidding public higher institutions from profiting from receiving money that goes directly from direct advertising to their college students. And I'll keep you updated on that. I'm not sure if it's right now on the floor for review, but those were a couple of the bills that we were following. PGAM was an extremely busy month, as it always continues to be, with lots of new resources. So I want to pull up the web page for, sorry, Daniela, can you pull it up and I'll quickly walk people through it. All right, if you haven't had a chance to go to the Hub's problem gambling gaming webpage, we scroll down, Daniela. Okay, you can see some of that information survey that you can take, but under resources, okay, so there's the van. That van's going to be on June 11th, and they will go anywhere. You can go to responsibleplayct.org, and there's a calendar where you can book them, but again, we get to see them there. Come out there, but also through PGAM, there were some other new resources that will be on this website. One of them is brainconnections.ca. They have some really good, if you're in the school, they have some really good activities, a great video. So again, this will be up on our website. And then if you work with treatment providers, there's another resource many of us didn't know about called Buddies, and we'll send you the link. And they will, if somebody's going into treatment, but they need a place, home for their animal, they will provide foster care while somebody's in treatment, which I thought was pretty cool. Keep going down, Danielle. Thanks. Okay, here's all the resources and connections to CCPG. Keep going down. Yeah, and the videos, Caribe did their latest video that will be up there. But there's a whole collage this year. There was about 9 or 10 entries from across the state. They will be advertising. It's a $5,000 grant. So, I strongly encourage you to think about if you work with youth groups who might be interested in applying next year. It's a great project and some additional monies for a youth group. Okay, keep going down. And then fact sheets, etc., where you can get help. Keep going down, please. All right, and then the treatment providers in our region that are listed. Okay, so we have had Connecticut Renaissance has done some work in Fairfield schools presented, and some of their schools are now using stacked deck, etc. So we're seeing an overall increase. Our priority matrix showed we certainly have increased in magnitude and prevalence, but community readiness is where we're really going to be working. This past year, we had what we call the boot camp from CADCA, in combination with doing the EpiProfile priority matrix. So all of those have come together to really narrow down on a focus for the team for next year. So again, well, as soon as they get hired, and we'll have this new person out in June. So we're excited about that. And please don't hesitate to reach out if you've got any questions.
Ingrid, real quick about the van. Does the van, when the van comes to a location, is there someone there available to answer questions, provide resources, yada, yada?
Yeah, and they have resources, and so it could be any kind of event. So if you go on there, you will see, I think they have about 4 different staff. It's a partnership with MCCA, CCPG, and PGS. And so, yeah, we're excited about having that. I think that will really help increase certainly awareness around that. That's our biggest challenge, that we saw, that it's so normative, sports betting and those kind of things. So if we can move the needle on community readiness to look at it. But so it continues to grow. But yeah, we hope to see you on June 11th, you know, free food, free tchotchkes, see the van, meet the new coordinator, all that stuff.
And Ingrid, who was the gentleman that came to the Greenwich Together Coalition meeting in March and did that presentation?
Fred from PGS. Fred
Yeah,
came.
just a shout out. He was great. And
Yeah.
I think the coalition members learned a lot and didn't realize the extent of the problem. So
Exactly. So yeah, there's, you know, plenty of opportunity to have people come out to your meetings. So thanks, Ellen. That's it, Daniela.
All right. Thank you, Ingrid. Next, we have Michelle from Liberations as well. Ingrid would introduce her, so if you could do that.
Okay, so yeah, so Daniela asked us to talk about xylazine and sort of give a flavor of what's happening. And fortunate at Liberation through the harm reduction initiative to have Michelle, who coordinates overdose outreach and who can really talk about xylazine. I sent Daniela a drug fact sheet if you haven't got that one already from Clearinghouse, but Michelle's going to talk about sort of on the boots what we're seeing and how it's being addressed in our region. So on that note, I'm going to turn it over to Michelle.
Thanks, Ingrid. Hi, everybody. I'm Michelle. I'm the Outreach Operations Manager for Liberation Programs. We have several grants that allow us to go out into the community and promote harm reduction. So just a little bit about us is that we're out on the streets 7 days a week from 9 a.m. to midnight. We're out in Stamford, Norwalk, Bridgeport, and sometimes Greenwich. We also have a COSAP grant through the Bureau of Justice, which allows us to partner with police forces in Greenwich, Bridgeport, and Stamford. We're also looking to expand that to other areas to do post-overdose or at-risk responses to individuals. We provide harm reduction supplies off our van and out of our office, including Narcan, clean syringes. We also provide referrals to housing, treatment providers, MOUD treatment, substance use treatment, detox, pretty much everything and anything that people might need. We try to be the glue that kind of connects them to them. So as part of our outreach work, we are part of a Brandeis University study that's doing a drug testing study up and down the I-95, I-91 corridor. So we have seen for sure xylazine in the drugs in Connecticut. What we're finding with xylazine is that it is mixed in with other drugs. It's not just xylazine all by itself. And the concentrations that we're seeing in Connecticut are actually quite high compared to the rest of the I-95, I-91 corridor. So we're seeing like a 1 part fentanyl to 5 part xylazine combination. So it's really, really high density of xylazine as compared to other parts of the country near us. So does everybody know what xylazine is? For the most part, okay. So xylazine is a veterinary tranquilizer that is not approved for human use, that is being mixed in with other drugs, particularly fentanyl. The dope that used to be heroin is now fentanyl, and now it's fentanyl and xylazine. So it's just the newest, drug on the table that's available out there in the streets. And what it's doing is it's causing really horrific wounds for people. Sores, not particularly at the site of injection either. Sores can appear on face, arms, and what happens is they get very, very swollen, and they typically need to be lanced off to be treated. What we're finding is that a lot of our clients don't like to go visit the hospital. So what we've done in an effort to ramp up our efforts is we've supplied additional wound care items for our clients. So we have additional gauze products, sterile water, wound wash, as well as zero form, which from a conference call, we were told that is a great thing to be putting on the wounds, because the wounds, you want to keep them moist, you want to keep them covered, and the zero form allows them to do that. So we have a fantastic supply of that here in our office and are providing that to our clients along with, a little bit of education about what's going on. So since we started our drug testing study in January, we've received over 105 samples of drugs. So what we've found is that our clients are very interested into what is in their drugs, which is really nice to hear. And what we're finding is that the fentanyl is mixed with the xylazine, probably in about 95% of the cases. The cocaine is really cocaine, but the fentanyl is fentanyl and xylazine. Another effort that we're doing is we're working with our police partners in Greenwich, Greenwich, Stamford, and Bridgeport, to educate them on what's going on with the drug supply in Connecticut. We've worked with the police forces over the last year with the overdose response, and we are working with them to keep them educated as to what is going on, particularly because when people are overdosing, they're not coming to in the same way they used to. So because xylazine is a tranquilizer, it's keeping people very sedated. So we do recommend that people get Narcan, but the Narcan is not going to work on the xylazine. It's just going to work on the fentanyl. So people are coming to, and in the past, people used to come to and they used to be very upset because you just ruined their high and, get really angry and want to like almost hurt you. But now what's happening is people are getting Narcan and they're coming to and their breathing is improving, but they're still very, very sedated. So what we've been told is don't continue to give, 20 doses of Narcan. Make sure that we're calling 911, make sure that we're getting them to the hospital so that they can be treated there. We know that the hospitals are still learning about this as well. And we're doing our best moving forward. We are hiring for another position as a community education coordinator to be able to expand our efforts and our education to some of our medical partners in the community. Ingrid, do you feel like I covered everything?
Yeah, I think the other thing is, and if you're Drug-Free Coalition, there was a really good presentation a couple weeks ago on this, but is for you to know that when people go into the emergency departments, if the EDs don't know about xylazine and understand the withdrawal, which is even worse than fentanyl, they need to be able to address the withdrawal first. So we are connecting with DPH because the New York Department of Health has sent out a really good handout for clinicians that includes managing withdrawal. So I think that's what I found very interesting was the withdrawal component, because if that's not addressed and somebody thinks they're coming in for wound care, but they're not addressing that, the person will leave. So we'll keep you updated on our efforts with that, with Connecticut DPH. So, but yeah, I think that's pretty much, I think, like to say the 1 to 5 ratio was kind of what surprised me.
Yeah.
Talk about what the withdrawal is like.
So what they're talking about, there's just, some of the things that you will see. Well, certainly the agitation. I don't know the physical effects, Ellen. They didn't talk about that, but they just talked about it almost felt like crawling out of your skin. And it happens so quickly. So they do have a protocol. This was a doctor from Philadelphia where they've been working with this for a long time. And I can send the New York State Department of Health piece that Liz Evans from our harm reduction, what clinicians need to know, and it covers some of that. But I think that's that. And the other thing is they show stories about people injecting into their wounds, which I always thought was, more direct effort. But really what in fact is, and Michelle told me this, was that people are afraid, obviously don't want to get the wounds. So they think that if they inject into the wound, that will stop it from showing up somewhere else. But as Michelle said, it's not at the injection sites, right, Michelle?
It's not at the injection site. It can, and we've had people that have smoked or snorted the substances and they get weird little sores on their faces, on their necks, on their noses. And really, I mean, we recommend that people seek medical treatment, but in the absence of wanting to do that, we've just kind of amped up our outreach efforts and education directly to the community.
So Michelle, this is probably a naive question, but I'm asking anyway, the reason why xylazine is being mixed with fentanyl, because, you know, fentanyl is dangerous in and of itself, but is it, are people doing it because they think it's a safer way of getting their high, or what's the rationale of mixing with the fentanyl?
I think the rationale when it comes to drugs and the mixtures they use usually comes down to dollars and cents. And what happens is it's probably cheaper and it gives them the sedation effect that they would normally get from like a heroin at a much cheaper rate. And they don't necessarily, you know, it's not like they have a Betty Crocker recipe book when they're mixing up these drugs. They you know, use what is available to them. And I mean, I've tested over 100 drug samples, and you'd be amazed at the combinations that I've seen. You know, there's cocaine and ibuprofen. Like so at least they're not getting a headache. But you know, you know, there's no cookbook for this, and that's why we were really alarmed when we saw the ratios.
It also extends it. So to your point, Michelle, it extends the duration.
Yeah.
So,
yeah.
Okay, wait, this is great information. And then, so with the mixture with fentanyl though, so you've got a tranquilizer, but then you've got a pretty powerful high with the fentanyl, right? So you're kind of deadening the impact of that high, right? I mean, talk to me about that's what I want to know.
I mean, I have clients that are expecting to get fentanyl and now they're getting xylazine and they're not happy about it because it is a different kind of high.
Right.
But again, they only have so many sources to get their drugs from, and you know, it's hard for them to find another good, reliable source. So they're just dealing with it. You know, the high is definitely different. People are experiencing more like high blood pressure and things like that. But you know, the nature of it is that, you know, they're used to having an inconsistent drug supply. This is just the newest thing that's out there. And once we get used to this, there'll be something else.
Yeah, I first saw a documentary about 5 years ago on this in Puerto Rico, where it was huge, and it certainly cost was one of the things, is that they could access it and it was much cheaper. But visually, it was just really sad to see the wounds and what people were going through.
So Ingrid and Michelle, when you said it extends the duration, do you mean of the high or?
Yeah.
Okay. But it's not a high that they're particularly seeking.
So with heroin, they tend to get like a good nod on, and this tends to give a very severe nod. So they're out for an extended period of time.
Okay.
But that's why we have to be careful, because they're both kind of tranquilizers and suppressing the breathing. It's very important, even if you don't have Narcan, to give somebody breath. We do have safe CPR masks. We have a great supply of those that we've gotten through the state of Connecticut, through DPH, that we give out with our Narcan kits, because even if you can't give them Narcan for some reason, give them breath and call 911, and the breath alone could help save people.
So Michelle, are you also working with AMR and the various EMS services?
Presently, no.
Would you like to?
Sure. Yeah, like I said, we are hiring another position to do education coordination with community partners. But in the interim, I would be more than happy to step in and speak to some of these folks and see if we can get more education out there. Because we just got everybody used to the whole fentanyl Narcan thing, and now we're throwing xylazine at people.
Yeah, I could give you, Anthony Murrow is the AMR contact that service Fairfield and Bridgeport.
Oh, perfect.
So, I can get your email.
I'll put it in the chat.
Okay, thanks.
Yeah, I'll put my information in the chat for everybody. So if you think of any other questions, or if you just want to have a quick conversation, you can shoot me an email, give me a phone call. I'd be more than happy to speak to you about xylazine or any other drug that's out there on the streets.
Michelle,
Right.
Ingrid, you mentioned that the withdrawal from fentanyl and xylazine is more intense. It can be more intense. So is there anything different happening at detox centers, or are they equipped to help with this withdrawal?
It's my understanding that detox centers are starting to figure it out. Because people will get antsy from the withdrawals. They're typically used to that at detox centers anyway, people being antsy, being irritable, but they're still figuring out, you know, the correct drug combinations. And I think some states have figured it out better than others. And really it's just the communication through forums like this that's gonna get the word out even further.
Yeah, so Caitlin, we're working on that piece of it because there was some consistent information from Philadelphia. And I also emailed Liz to look at, from a prevention perspective in harm reduction, what information should be added now into the naloxone trainings. And I'll send that to you because I think if somebody administers it and the person's head is still down, which is what we described, right, Michelle? Because they're still, you know, and sort of the additional steps needed for that. But we don't want people not to administer naloxone.
Because it will still work on the fentanyl portion of it. It's just not gonna make them come to in the same way that it used to, because they do have that sedative in their system. And it's a very strong sedative.
Yeah, really, really strong. So, okay, thanks, Michelle.
You're welcome. So I put my information in the chat. I'm gonna get back to work. And if anybody needs to reach me, feel free to reach out.
Thank you so much.
Thanks so much.
All right. Giovanna, would you like to give your update since you hopped on now?
Yeah, that would be great. Thanks. Hi, everyone. Good morning. Nice to see all of you. I'm going to give a quick update on the state opioid response mini grants. As of this week, I have heard that the contracts are still at the AG's office. There are some issues going on. So currently we do not have or hold the sewer contract yet. However, what I keep on hearing is that we should be getting it sooner than later. And they're looking possibly sometime in early May. So in the waiting period, and hopefully, you know, we do get it in May. For us, I think we have been really advocating to DEMIS to say that a lot of the local prevention councils don't do work in the summertime. This contract would begin effective backdated to January 1 through September 29, 2023. So for those that don't work or at least do anything service-wise in the summertime, you still have August, September to finalize anything or spend down your dollars, I should say. So I don't have much to tell you. The one thing I can tell you is that we are working on updating the mini grant, and we will be sending it out within the next week and a half to all of you, so you can apply. But just please understand that when you do send the application back, that we don't have the funds to pay to pay you guys just yet. So once we do get those dollars, then that's when I'll be able to disperse those grants to you. What I would like you to do is start to just think about what your work plan would look like, especially if for those that have been doing Narcan trainings for the last couple of months, or if you've been doing anything that's related to opioid prevention strategies, what were they? Because like I said, we'll backdate it to January 1. What I will say is that we will continue to work with Katie for You Think You Know, and that is something that I would hope that all of you will put as your work plan to have another 3 months You Think You Know campaign for our region. I will have that in the work plan, or at least the application, to just say have at least about $1,000, because again, I don't know what the cost is for billboards or king and queens and things like that. So Katie and I will be working on that, but we're thinking around anywhere from the 788. Excuse me one second, people are walking by. So anywhere from I would say anything around $1,000 is what we're going to be asking folks to kind of just hold and have as one of your activities. Any questions?
Hi, Giovanna, Melissa. Yeah, I think one, if we can do more regional work around You Think You Know, it especially the some of the digital geofencing was really effective. I think I was seeing it in some really unusual places. So if we can collaborate, the bang for your buck is just really powerful. The other thing, just a tip from TPOD, we've had a lot of success with our SOR dollars buying lock boxes and partnering with our community, within our community, with our senior center and our counseling center and our Y to distribute medication lock boxes, but we've also rebranded them as medication, vaping, and cannabis lock boxes. So you can kind of tick off a bunch of substances with that one. And there's some good suppliers out there that I'm happy to share that you can get them for like $10 a piece. So you get kind of a lot of bang for your buck.
What I will do, Alyssa, is maybe not today because I'm at Sacred Heart until this afternoon, but what I'll ask is if you can send me that those contact information, and at least I'll be able to put it into the store application and announcement, so everybody has that already when they're looking at their work plan and kind of finalizing it. The one thing I will say is that because I don't know when we are getting a contract, and again, I apologize because we keep on talking to Demas about this, and it's really frustrating on our end because we have been doing the job since July 1, and we still have not gotten paid. So you can imagine my frustration when we have staff members that are doing the work and we're not seeing that, and we're actually borrowing funds from our fiduciary RISAP. So it's really frustrating. And Demas knows that it is, we're really over this. So I'm hoping that AG's office will get us the application or at least the contract sooner than later. But what I am thinking is that once we complete the SOAR mini grants, we will send it out to you. And I'm thinking to have maybe a 3-week turnaround. And if that is not sufficient, please let me know, because what I'm hoping is that if we can have a turnaround, and when we get those dollars, I'll be able to just send out those monies to you as soon as possible. So you can at least try to spend down your money. If you cannot, if you have a thought that I can't spend down $5,000 in a short period of time, please let me know, because we can help and support you in how you can do that. And if you think you're not going to be able to spend it down by the end of September, then I will ask you that do not apply then. If you don't want our support, and if you don't want, and if you can't spend down that money, okay?
Giovanna.
Somebody has a hand up.
Yeah, me, that's Kathy.
Hi, Kathy.
Hi. So since you're at Sacred Heart, you could ask about the Fairfield opioid settlement money, since that apparently is being used to put that
That's
presentation
why I'm here.
We've been given absolutely no information. It's been very frustrating. Supposedly 13,000, maybe 23,000 is coming to Fairfield in opioid settlement money. We've been given, as the local prevention council, we've been given absolutely no information. So perhaps you could explore that a bit. But
I
getting back-
I am, and
you.
I have been, and I've confirmed, yes, these dollars have been spent with the opioid settlement. But I'm working on it, Kathy. Don't worry, I got you.
I appreciate that. It's a shame that politics, it just controls so much in Fairfield. It's really a shame. But back to the SOR, given the short turnaround and the short time frame of this grant implementation, will there still be, as you know, we've complained that there are just too many deliverables. Will there be fewer deliverables in this short time frame? And also part two of that question is, will we be able to use more, I don't know, pay for staff time? Like right now, I give Narcan trainings for free. And I would really like to be paid to do Narcan trainings, quite frankly. Would it be possible to have that infused into the grant?
It's always been that if you chose to use some of those dollars for administrative costs, you're able to do that.
Okay. 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 All righty. Yeah. All right. So, but in terms of
Because
the
again,
deliverable-
if you're doing the work, you should be getting paid to do
Exactly.
that work,
No.
right? So I don't think that was ever anyone's expectation that you guys would be taking these dollars and working for free or pro bono, because ain't nobody got time for that.
Yeah, exactly. But will there be fewer deliverables, do you anticipate?
So there, that has not been spoken about. And right now there are 3 deliverables that are required, and then you have a choice of another 3, right? So a choice of another 3 out of, I want to say there's like nine prevention strategies, but you can choose 3. Again, because of timing, and I will again go back to the state and see if they will reduce the required numbers or the additional prevention strategies. But I will say is you don't have to do as many then, right? So if you are doing
We still have to do 6.
Say that
We've got
again.
We've got 3 required and then 3 optional ones.
3 optional.
Others, but we still have to do a total of 6.
A total of 6, yes.
Right.
But what I'm seeing is that folks are doing the total of 6 times 10. So for example, Victoria, did you recently look at the mini grant? I'm trying to think of one of the deliverables.
Well, in any
Geez,
event,
I can't think of it. I apologize.
No,
I
it's all
can't
right.
think
I
of the
even-
deliverables. But what I'm saying is that if you chose one deliverable and say that is CPMRS, right? And getting your doctors to be registered to the
Monitoring.
thank you, to do that. You're sending out what? You don't have to send out a letter to all of your providers in Fairfield, right? You would say, I will work on 10 letters, 5 letters, whatever your capacity is, right? 5 letters to get it out to providers and do some outreach, right? So what I'm trying to say is, like, you can do some things, but don't go break your back. Don't go stress yourself out when typically, especially you, Kathy, I will say that you do a lot, right? And that's just your nature. So I would say is don't do as much.
Well,
in
I
this
would
case.
like to do more on a regional basis,
Yes, and that's where what I'm starting to think about what we can do. So for example, like doing the You Think You Know campaign, a 3-month campaign regionally, pooling dollars together, right? Another thing was, what if, we have the lock boxes. What if the pub is able to purchase a bulk, right? If we can do the work, right? We'll do the back end work and get those lock boxes to you. But then you would have to do the work on outreaching to senior centers, to youth service bureaus, to shelter, or not shelters, but other various stakeholders within your community. So again, that would be having a bulk order to then reduce the cost, right? Again, I will say, I don't mind, doing things regionally, and the team can figure out what those things are with assistance from all of you, right? Because I don't want to choose something that maybe that's not a priority in your town, right? I don't know what is it that you would want. So that would be another meeting and another conversation, moving forward. We will have a meeting once we send out the SOAR mini grant. I will ask that everybody, whoever wants to apply, attend the meeting, so we can kind of talk about the contract, or at least the grant and the work plan. So that could be another conversation where we could talk about pooling dollars and doing things regionally.
Giovanna, it's Ellen. How are you?
Hi.
So question, probably a silly question, but is there any?
Never a silly question.
Yeah, well, wait till you hear it. Is there any possibility that they would extend the grant past September 30th?
That's a silly question.
Okay, see, I told you. All right. The other question is, what
unfortunately, so this is the thing. We've asked that question. We continue to ask that question if we can extend it, and they continue to say no. But we do know that the federal SOAR contract that DEMIS has is a 2-year contract. But they're telling us that mini grantees can't, and us as well, because our contract ends September 29th as well, that they can't extend it.
Okay. All right.
Mm-hmm.
All right. So the other question then is, we do a lot with Hearst Media for our social media posts and Instagram and all of that. If we paid them, but then the post maybe happened after September, would that be appropriate?
Prepay is okay.
Okay. All right. And just so people know,
you just need to spend down those dollars before the end of the contract. And to be honest, I really don't care how. If you want to prepay things before, so that then you can use it for later, by all means.
Okay. And then, Melissa had given me the product producer of those lock boxes, and they're great and people love them. And we also, if somebody's looking for something in the summer, we go to farmers markets sometimes, because they happen all through the summer, and it's a great place to distribute them. So just a suggestion. Okay, thanks.
Thank you. Any other questions about SOAR?
Hey, Giovanna, it's Margaret.
Hi, Margaret.
Hey, what's the status of, is SOR going to allow us, I guess it's a 2-part question, because are we allowed to buy fentanyl test strips, and or there are now xylazine test strips, but I guess they're not super proven, and I don't know how many are available. So one question is SOR even going to allow that as part of what we can do? And then part 2 would be, I think, where it would be helpful, maybe I should ask Michelle when she was on, but is that something maybe on a regional basis that we should be looking at purchasing? Or do the treatment agencies already have access to such a supply that that's not a need?
So your first question, you can use your SOAR dollars to purchase fentanyl test strips. You cannot purchase xylazine test strips, as they are very new, and FDA has not approved any of the SOAR state grantees used to purchase them just yet. But I will double check with the state and just make sure to keep that on their radar. I did hear about the test strips as well, but unfortunately, xylazine, no. Fentanyl, yes. Your second part of your second question. So we do have a lot of treatment providers that have fentanyl test strips already that they're using as part of their harm reduction toolkit. So they are using them. However, when you say if we should purchase them on a regional, in a bulk, when I spoke to folks in the communities, they didn't really seem like they wanted the fentanyl test strips, and that's why the hub never purchased them, because there weren't individuals such as shelters or again, for me, a treatment provider should be offering that, right? Yeah. We should not be giving them fentanyl test strips when they are a treatment provider. They should have those funds to purchase those strips specifically. I'm talking about the other stakeholders, the other community folks that may have or work with individuals that are substance use disorder, and they don't have a treatment facility, right? And that's why I said the shelter, right? Because that's where you want it. Or if someone's coming out of incarceration, maybe having that in one of those bags. I hate to say goodie bags, but you know what I mean. So there are strategies that you can use for the fentanyl test strips, but for us, I even thought about, what if we put the fentanyl test strips in our Narcan black bags, right? When we are doing Narcan trainings, right? And giving that to the attendees. But then again, a lot of the people that are coming and doing the training are not substance users. However, they are professionals more so than anyone else. So what are we going to do with those fentanyl? What are they going to do with those fentanyl test strips then? Right.
Giovanna, I was thinking it might make sense for us to include them in our Narcan Leave Behind kits that Trumbull's piloting right now, where we are leaving kits behind at the sites of a suspected opioid overdose.
Yes.
So it might make sense to put those in there. We haven't done that yet, but it's good to know we can use the funding for that.
Yes. And that, yes, it's going to the people that are struggling with substance use disorder, right? And that's why I said treatment providers are doing that already. A lot of them are harm reduction. Now, if a treatment provider came to me and said, Giovanna, we don't really have funds, can you support us for a time being so that we can figure out our budget to get it on the line item? Okay, no problem, right? But we can't sustain that. And that's where I think a lot of times the opioid settlement dollars that every town received, those are the things that they should be doing to support everyone within their town. I hope that answered your question, Margaret.
Yeah, that was great. Thanks.
Any other questions?
Yeah, Giovanna, just, and I'm glad you clarified with that, because I find in some of the naloxone trainings, especially when you're talking about fentanyl being mixed in with recreational drugs like cocaine, then people consistently ask. So that's another scenario of where having them available at your naloxone trainings, depending on your audience. Moving forward, this is great because, yeah, there's so many different target groups, but I've had requests, particularly when you talk about that.
Mm-hmm. And what the hub actually did, specifically Victoria, Katrina, and Jeremy, they did a really nice logic model with a comprehensive strategies work list that was really identifying in our region. So they did a whole assessment of overdoses and where and what could they do, right? So we, as the hub, will be working on specific outreach to the certain populations moving forward into this this contract. And we will be happy to share that with everybody as well, just so you can see what our findings were, because I'm sure everyone else will have some similar thoughts to the data that was analyzed. But yeah. Any other questions around SOAR? I think the last update, and I didn't see anybody raise their hands, but I think the last thing I'd like to just really talk about is the event that the Attorney General Tong will come to Bridgeport at Burroughs May 17th, May 18th. 18th, thank you. I don't have my computer. I'm in a hallway at Sacred Heart. I have no idea what I'm doing, like always. But I think it's really important that we get the message out. I know that some of the towns are struggling trying to identify where the opioid settlement dollars were, at least the first payment, and who is really, and what I found is that in me asking questions, the towns received the dollars, but the problem is that once it was given to the town, and then your first select person or your mayor then identified a certain department to manage those dollars. And what's happening is that every single town is different. So like, for example, Fairfield received those, Fairfield Police Department received those dollars. And it wasn't a social services or, any other entity. So I'm trying to identify who within the town received the dollars, or at least managing the dollars, but then also the contact, so that then we can get the person to the AG Tong event, because he's going to be talking about the opioid settlement dollars. But now that we are receiving the Jewel dollars, settlement dollars, he'd like to talk about that too. And he's going to be talking about the expectations and really hoping that all of the towns are putting the dollars back into the community at large and supporting those that are doing the work around opioids, like you guys. And that is my spiel that I keep on telling folks. This is not for us to gain dollars. It's for you guys to gain those dollars within your communities to then expand the opioid prevention work that you guys do. And then, of course, talking about other agencies like treatment and recovery agencies that are doing the work too. How can we expand? I'm not going to call out a city or a town, but we get calls all the time from fire departments or police departments saying, oh, our Narcan expired, we need 70 kits. Well, that should be in their budget already. It's how many years have we been going through this, and they still are relying on us to give them those kits. Mm-hmm. My hope is that the opioid settlement dollars should relieve that from the police department and put those or fire or whatever first responder, and that shouldn't be on us anymore. It should be the support of the city or town. And we should be really focusing on getting the Narcan to family, friends, and those that are experiencing substance use disorders. So what I'm hoping is that when we finalize the flyer and everything else, I'm leaning on all of you to really push that flyer out to your stakeholders we need several representatives. If we get one, fantastic, but really I think more than one person needs to hear the message that not only AG is going to say, but us as the hub too, because it's going to be important.
But Giovanna, I think it's really important that it's stated in whatever official documentation decides on, who gets what amount of money, is that the prevention dollars go to the local prevention councils, period. That needs to be stated, because the fact that we've seen zero money and it's now being spent, Bobby Lawler gives a great presentation, but, I could come up with some other ways of spending that money.
Kathy, I don't know if you've seen the document, but every town got a document. It's like 300 pages long. That is the settlement document from the manufacturers. So you kind of have to go into that document, because even the Attorney General doesn't have the ability to, I think, to tell us how we have to spend it. It's a settlement between the town and McKesson.
But the point is that the term local prevention council needs to be identified in those documents as a recipient of prevention dollars for the town. Period.
Yes, unfortunately, you're not going to find that because AG Tong is, it was interesting the first time I met him, and all 5 RBHAOs were present to really talk to him about the struggle that we're experiencing. And he was actually really upset because he's fought for the settlement dollars for a long time. And he will tell you firsthand that he did not put $1 or invoiced anyone all of the work that he has been doing. So this here is very close, near and dear to his heart, and he wants to make sure that that the opioid settlement dollars go back to the community. I'll have to resend it, but it's a blue and white document. It talks about how you can spend the opioid settlement dollars. And it has prevention, treatment, and recovery in there. But it's not specific like you're asking or wanting, right?
We weren't even part of the conversation. That's what's frustrating. Never mind.
No one was.
Well,
not even.
There is one of the bills that Kristen McCarthy-Vahey's Public Health Committee had a bill that was up for testimony a few weeks ago, that one of the things he wanted to do was make it so that towns had to report how they were using their opioid settlement money, because they don't even have to tell anyone how they're using it right now, because the settlement is between the municipality and the manufacturer. The town does, the state of Connecticut does not really have a role.
Correct.
So that is the
Absolutely.
challenge, Kathy. Right now, they don't even have to tell anyone how they're spending it.
No, not at all. And thank you for saying that, because that was the conversation that I had with his team in trying to coordinate the event in Region 1, because I asked for the document. Who did the money go to within town? They had no idea. But then when I asked them, so you give them money, and then what? Where is their accountability that these folks, these towns, are not putting it in their pocket or putting it somewhere else in their budget line? Like, how do we know that that is, being used for what the settlement was all about? And they said, we're working on it. So of course they gave money, a first payment to the towns because they needed to, but I don't think they really thought through everything. So that's where we're really, we're talking to the AG, of course, about, but that also brings me to you guys making sure that you're at the event, because they need to hear you. He needs to hear you, and how the people's situations are all difficult, and how they're asking, or what is happening with the opioid settlement money, right? I can tell you Bridgeport, they said to me, they spent it, and they didn't tell me where, how, who, nothing. And it's like, oh, okay. And they don't have to, right? Like Melissa said. And it's just really frustrating, because those dollars are meant to put back into the community in prevention, treatment, and recovery. So,
Can you,
like I said, I
Giovanna,
think.
can you share that logic model that the hub created?
Yes,
Sorry.
yes.
Can you share the logic model that you said? Because I think some of us are trying to make the case still that like our money is unspent in Trumbull, and we are currently trying to make the case that GPOD should manage it and coordinate with all the other departments on how it's distributed. But it would be great to like work from an existing logic model.
Absolutely, absolutely. I'll send it most likely on Monday, since I'm not in by my desk or computer today.
Thank you.
But yeah, so I think there is a lot of education that we need to talk to AG Tong about that he is not aware of, right? So I think it's going to be an enlightening day for him and for us, because he is he's a passionate individual that I appreciate. So we definitely need to plant the seeds in his mind about certain things that we're experiencing, and hopefully they will get rectified.
All right.
Any other questions?
Just to like reel us in, we only have 45 minutes left. So maybe we could set up another meeting. It sounds like we could follow up with us, talk about the logic model, maybe prepare things for May 18th and kind of have an agenda for that.
Mm-hmm. If no one has any other questions, I'm gonna go back to the conference. I'm sure I missed a good amount of it, but everyone have a wonderful weekend. Enjoy the lovely weather.
Enjoy Fairfield's opioid settlement money, Giovanna.
Hey, there's some good breakfast here. Just kidding. Not funny, but funny. Bye, everyone. Take care.
Bye. So just to keep things moving, I have James and Magna next to talk about the interactive theater.
Thank you. So yeah, I'll introduce Maggie. She's the Executive Director of Interactive Educational Theater. We've worked with them for longer than I've been part of Stratford. So over 8 years I've known her. She's worked with Tammy for a very long time. She could probably tell that number if she wants to. She might not. But they've worked with us at the middle schools and high schools doing various presentations. We've done it with our summer camps and other programs. They put on little skits, but then they're a lot of fun, always get good laughs, but then they always tie it back to real events. So they provide that educational component that captivates kids, it keeps them engaged, but then, you know, gives them a little bit of information, something to think about also, that they could go home, talk to their parents about. And they have some funding right now through CCMC where they could provide these shows, and I'll let her, you know, introduce herself and explain what they got going on and what they can offer to everybody.
Thank you, James, and thank you all for having me. This has been extremely enlightening, all of this. I've been taking more notes than I can tell you. I'm writing more skits as we talk. But Interactive Educational Theater is a small nonprofit that I started back in 1993. And what we do is basically, and I've worked with some of you before and in your communities, we tour around mainly Connecticut, and we do presentations that are interactive with the audiences, usually assembly format. But once again, you know, if we go to a community center, it's going to be smaller. When we go to correctional facilities, it's going to be a smaller component in the, you know, school setting. But normally we do assemblies, and we cover all different social issues, whether it is drug and alcohol, whether it's opioid, whether it's sexual assault. We do a lot with sexual health, and of course, LGBTQ, anti-bullying, kindness, you name it, we've kind of do it. And what we do is we do it in skit format, but every place we go, because let's say it's a middle school, they know their students. So we sit down and we give them a menu of skits, and they pick what they deem appropriate for their students. And then we go along with that. And we do use humor. We use humor to keep them, laughing and into it, but we do bring it right back down to reality. And we constantly ask them to think about it and one simple thing, keep the conversation going, no matter what it's about. If it's about drinking, if it's about going to a farm party, if it's about, seeing someone getting picked on, bullied, even just being treated meanly. Keep the conversation going about how you can be an active participant in making your community better. And with the little ones, when we do mostly kindness, mean-spirited behavior, what have you, we bring them up on stage. We get volunteers and we have them act out the strategies so that their peers can see them and showing, listen, this person's, saying this to me, how can I deal with it? And without, picking up a chair and doing a WWE, what are the strategies we can use? The grant that we did get that James had mentioned is from CCMC, Connecticut Children's Medical. We've worked with them for about 20 years, and Hartford Healthcare now. And it does focus on destructive decision-making, which is consequences of drug and alcohol use, whether it's self-medication, whether it's for anxiety, stress, and also consequences of regarding sexual health. And the fact that our STD rates are skyrocketing. Thank you, COVID. So we talk about that. And once again, we start that show normally with 8th graders because they're transitioning into high school and they're already facing a lot of this stress, anxiety, and this peer pressure, the vaping, we talk about fentanyl, we talk about the marijuana, and we talk about, the opioids and getting them online. It all depends on what the school wants or the organization that we're going to wants. For some, they just want to focus on the high school, which is a completely different level show, as you can imagine. We can really up the level of maturity because they can handle it more. And they know a lot of what we're talking about. So as much as we want to educate them, we want to, once again, get them to just think about what they already know. Because so many of them, yeah, I know that. Oh yeah, marijuana is legal. Yeah, okay, fentanyl. Yeah, okay. Well, they're not going to a dispensary, when they're 14. So, and if they are, wow. So they need to have that knowledge, but we do it with a funnier approach. And then we bring it down to like a true story and talk about the young people that have shared their stories with us in our travels and what have you. We also are waiting for a grant for the fall from the Faith Summerfield Family Foundation out of Greenwich for our anti-bullying show. And that really is geared more towards elementary and middle, but we do have a sexual harassment, acquaintance rape kind of relationship show that goes along with that for high schools. So did I cover it? I haven't done a Zoom in so long. This is exciting.
Yeah, so we had them at our middle school, I think it was 3 weeks ago now. And I figured I'd just share, we got an email from the assistant principal who organized it. And he just said, I want to express a huge thank you for helping bring the interactive theater back to Worcester Middle School. They did a wonderful job and hit every topic we had discussed appropriately. At lunch, I was asking students about their thoughts, and everyone enjoyed the show, recognized the themes, and thought the presentation was both fun and good. I'll be asking our families in the weekly update to talk with the students about the performance and topics that we address over the weekend.
Yeah, it was a lot of fun because Worcester's great.
And so the entire school, they broke it down into a few sessions. So we hit over 500 students that day.
Yeah, and right after we went to Greenwich High and did this destructive decision making for the high school, which was a total different environment. But it was a lot of fun because you get to see the difference, the transitioning from middle school as they go into the high school years. So, any questions?
Maggie, you were in Greenwich, you said?
Yeah, we were at Greenwich High. Kathy Steiner.
Oh,
my contact, Kat. Yeah, I know, right?
Yeah, she's great. Well, I just want to give a plug for interactive educational theater because I've known Maggie for, I don't know, 20 years or something. And she used to come to the Stanford schools when I worked in the AIDS program and did an amazing job educating the kids around HIV and STDs. And I mean, just there's nothing better. The humor, the kids getting involved, you could hear a pin drop, and those were tough schools that she went into. So I just, if you have money and can use her, please do, because she really is very impactful, she and her team. So great to see
you, Ellen. Good to see you.
You too.
Well, right now, right, Maggie, because you guys have the grant funding, it would, a good portion of it, there would be no cost to us
Absolutely.
as coalitions. Yeah.
Absolutely. Yeah, which is, I haven't done this in so long. I know this is so sad. How do I do a message? Oh,
I got it.
thank you. I'm serious. We did virtual all during COVID. So now that we're live again, it's like, I don't even want to be on the computer. Yeah, if you could do that. Thanks, James. But yeah, we do have the funding, and it would, we're going everywhere. We're going to be back in Trumbull. We're going to be back in North Branford, and it's prom time coming up, people. So we still have some open dates.
So could you say a little more? So are you saying that you'd be able to do completely free or discounted? Just have an idea of what kind of cost there is attached.
What we can do is, what the grant would really like us to do is we could offer like one full assembly, fully funded. And the assembly is what you want kind of thing, as long as it's destructive decision-making and the time, you pick the time element, what have you. And then while we're there, we would do another performance, and either at a reduced cost, if we have, what we call our scholarship funding at Interactive, if there's anything left in the till, so to speak, and we would, try to lower that cost for a second show. So that's what they really want us to do, is one per school or organization. But that being said, like all grants, as we get closer to the end of the school year, and we only have August and September as well, I go back to my contacts and say, listen, this is a school that needs 2 performances. Can I get permission to do that? So I always try to find wiggle room. But the first performance is completely funded.
That's great. Thank you.
Any other questions for Maggie? All right.
Thank you so much
Maggie.
for having me. Thanks a lot, James. I'll talk to you soon. Take care.
Bye. Okay, now, next on the agenda, just to kind of shift gears here, I would like to talk about May, which is Mental Health Awareness Month, and NPW, National Prevention Week. So for the entire month of May, the Hub typically makes a calendar of all events and activities that are going on for the entire month, whether they're virtual, in person. We update the calendar, we share it on a regional level. We do include things that are outside of the region as well, if they're free, virtual, easy access, things like that. So all I ask is, if you are planning anything for the month of May, please send over the information and flyers to me so we can update that calendar. During the month of May, it is also SAMHSA's National Prevention Week. This year, it is May 7th through the 13th. They took away the actual theme days again. So they're going with an overall theme now of celebrating possibility. But that was found to be really broad. And for the NPW committee, I meet with everyone, all the other RBHAOs in the state, DEMIS and such. We decided to come up with theme days ourselves that will reflect during that week. I'm going to put them in the chat now. They're currently working on a flyer right now, but hopefully this will provide kind of like a guidance So you don't have to do this every day. You could switch them around if you want. This is just what we kind of decided to go off of. So Sunday, gambling awareness, Monday, enhancing workplaces and recovery-friendly workplaces. Tuesday, opioid and overdose awareness. That is also May 9th, which is National Fentanyl Awareness Day. Wednesday, cannabis and marijuana. Thursday, alcohol prevention. Friday, men's mental health awareness. Saturday, vaping prevention. So that's what we decided. Here at the hub, we also kind of discussed potentially incorporating suicide to most of the days because there isn't a designated day for that either. So things like that. I would also
Daniela, will you
Yep.
send those in an email also?
Yes, absolutely. I'm
Thanks.
hoping the flyer should be ready by
There's a
Monday, but I'll put it in.
Yeah,
as
no
well
problem.
as-
That's fine. Thanks.
Saturday, May 13th is the statewide National Prevention Week event that is taking place. Here, I'll actually share my screen, but I will send this to you all as well. So that'll be Saturday from 11 to 3. It's going to be at the Connecticut Science Center. There's a theme this year of making it grow. It'll be kind of similar if you were at last year's, which was in Region 1 at the Discovery Museum in Bridgeport. There will be tables, events. Gizmo will be there, the Connecticut Department of Public Health, and all of the other RBHAOs and such. And there will be a ton of activities and such. It is free. It doesn't cost to go. I know it's a little bit farther. It is in Hartford, so maybe a little bit difficult for us. And I know May is also a challenging time with, sports, graduations, things like that. But if anyone's around. And then we also have the National Prevention Week art campaign. So I have sent this out to schools as best as I could, and even superintendents. They had done it last year, but there's guidelines here if there's any youth that would like to participate. Last year they got to go to the NPW event, share their artwork, and it was really cool. It was a cool experience. So I will send that to you as well. Does anyone have any questions? Is anyone thinking of participating in NPW or May? I know a lot of you have events going on. The hub will be very busy, but also exciting because we will be doing a lot of tabling events. So I'm looking forward to that. But if you have any questions or anything, let me know, and then just send over any flyers or anything that you plan on doing for NPW or the entire month of May.
I just wanted to put a shout out for an event that Fairfield Cares is putting on that is, we're inviting everyone, all communities to. Dr. Ali Lebowitz is coming to Fairfield on May 17th at our Tomlinson Middle School. So it's an in-person only presentation. He is renowned for his work on childhood anxiety, helping parents to better handle, manage their child's anxiety. So we know that anxiety is a huge issue. And so that is certainly open to all communities and everyone who would be interested in attending. So I sent the flyer to the hub already, and Danielle will get it out to you. So we're starting registration on Eventbrite. So please share that with your parents and your networks, because we want to be sure that Dr. Lebowitz has a good audience. I'm always fearful that nobody's going to show up.
All right, thank you, Kathy. Now I would like to talk about, so every 2 years, the hub completes a regional priorities report. All 5 RBHAOs are required to do so. We are currently in the process of doing that now. I would like to shout out our data committee. There were different stakeholders at the table. We recently met a couple weeks ago to determine our regional priorities. So we have to complete a matrix, which I will share now. So it's a lot of numbers here, but to focus on the right side is what ranks the top priorities in our region. So in previous years, they only had mental health as its own category, and everything else was underneath that. Now they've actually divided it up, and they have mental health disorders. But so specifically for Region 1, it was concluded the top 3 priorities are number 1, depression, followed by number 2, anxiety, and number 3, suicide. So that was very interesting to see. As we know, mental health is a huge issue. It remains a problem, not only amongst youth, but everyone across the lifespan, especially in Region 1, as well as the state of Connecticut. So this allowed us to have an opportunity to break that down and see exactly what is a concern and a top priority for the region. After that, number 4, there was actually a tie for heroin and fentanyl, and then electronic nicotine delivery systems, ENDS, vaping, and juuling. So I thought that was also very interesting because in the last report, they had combined tobacco and ENDS, but in this one, they had divided it, and ENDS was ranked number 4, where tobacco then fell to number 7. So we can see that vaping is still an issue, but the top priorities are mental health and mental health, some of those disorders, anxiety and depression, which we also know a lot of the time are dual diagnosed and co-occurring. What else? I would like to also highlight that marijuana had actually fell down the ranks to number 8. And then lastly ranked was cocaine. So I will share this out with you all, but I would also like to share, I had sent it out, but I will discuss now further. I had created kind of a bar graph comparison. The data committee, Ingrid actually thought it would be a great idea to see it compared to previous years with some of those topics. Yeah. Let me pull up Canva. So are you able to see this? So for all of the matrix, there's different categories. We chose to specifically pull out 2, which the first one was changeability, which is the indicator is amendable to change. Resources and evidence-based strategies are available to affect change in the indicator. Can outcomes impact be demonstrated in 2 or 3 years? So with this, it was a little difficult because, mental health previously was just one category in itself. This time they divided out, so we didn't have anything to compare to before. I did include tobacco and ENDS and vaping and juuling on here just to see how when it's divided out, you can see that it falls a lot. So the orange bar is 2020 and the blue bar is 2022. So for some things you can see here, there's been an increase in changeability for prescription drug misuse, as well as heroin and fentanyl. Cocaine stayed exactly the same. There's an increase in problem gambling, as well as suicide. And then tobacco fell drastically when ENDS and vaping were taken out and made their own category. The other one we chose to focus on was capacity and readiness. So resources and buy-in related to the problem. So some of those questions that we talked about were, are there adequate human and financial resources to address the problem? Is the community buy-in regarding the problem? Are there others in the region addressing this? Is it identified in strategic plans? So again, we have those same categories there. You can see that alcohol and tobacco fell a little bit, but ENDS, vaping and juuling was still higher. Marijuana had increased, as well as prescription drug misuse. Heroin and fentanyl actually decreased. Cocaine stayed exactly the same. Problem gambling had decreased, and then suicide had stayed the same. So we talk about this in a lot more depth in the report. As some of you may know, it's a very long report, but it is worth the read. There's a ton great information in there. We will be using this as well. Kind of my hopes is to take all of this information back and kind of argue the fact that LPCs should be able to focus on other things besides vaping. That may not necessarily be the priority problem for the next LPC year. So of course, we'll keep you updated, but it's very evident that mental health, is a large concern in Region 1 as well as the other regions. So we will see what the other regions have concluded in their priority matrix and what their data committee discussed and talked about. But that is what Region 1 will be focusing on, the hub here, those top priorities. Does anyone have any questions or anything? I know it's a lot of numbers and information, but when the priority report is finalized, there is that key that you can go back to and refer to with all of those questions and explanations, so you can have a better understanding and visual of seeing those changes from 2020 to now 2022. And it was harder for us with the data and working, Caitlin and Victoria can talk to this as well with the pandemic. A lot of that information and data just couldn't be included because it wasn't accurate. So that was kind of a bummer, but now moving forward, hopefully we'll be able to see what those trends are again. All right. So we have about 15 minutes left. We can take this time to talk about Delta 8 and THC and cannabis and everything that's going on. Kathy, I know you had mentioned some things earlier, so do you want to kind of get the conversation going? Do you have any questions?
Yeah, so if you don't get the Connecticut Insider, Cannabis Insider, it's worth subscribing to. It's through the Connecticut Post because it kind of keeps you updated on what's happening in the world of cannabis in the state. And in this morning's paper, there was an article about what was happening or what had happened in Stamford in the collection of the Delta 8 products in 3 stores that the AG's office, working with the Stamford police, had collected. And clearly, and I did not know this in advance, but there are lots of Delta 8, Delta 10 products that have 0.3 THC in them, which is okay. That was approved as part of the 2018 Farm Bill. And even some of these products that I've seen, like the Canna gummies that I'm seeing are the most popular type, at least in Fairfield, actually says that on the back of the packaging when they talk about the ingredients. So it's clearly stated as accepted by the 2008 Farm Bill. There is another product that I saw in Fairfield that has 10 milligrams THC, which, as I understand from the article, is against the law. That 5 milligrams is okay, but 10 milligrams is not. And I just haven't made enough of a study of a lot of there's THC, there's the alphabet of THC products that are all hemp or CBD derived that have been modified. So there's THCB, THCP, THCO, HHC, and I don't know enough about those products other than they are psychoactive, just like THC, and there's plenty, apparently they are legal. But that's what I'm not sure about. And so I didn't know, Ingrid, if you have any insights about, you know, what was found in Stanford, what have others found in their community, if you've been seeing the Delta 8, Delta 9, looking on the back of the packages. It was a real education when I did this vaping environmental scan, I have to say. A real education.
Yeah, I think, and I know that, I think, is Melissa still on? Yeah, she's
Yeah.
still on.
I'm here.
Yeah, so very similar to other communities. When I talked to Chief Conklin, because they did the raid about 3 weeks ago, and yeah, just almost every place that they go into, they will find these products that are higher than the legal amount. So that's consistent. And I think what was different about this was that the police changed their strategy from compliance checks, which were not doing anything, to then being able to, they learned that they were able to go in at any time, which is what they did. And they spent sort of an hour and a half, and there were hidden walls and just a lot of things. So it wasn't a case of an employee forgetting to check an ID. This was very deliberate. But the other thing that wasn't in the news, but that he had verbally shared with me was while the police were in these different locations, and the door was locked, they were surprised at how many youth were knocking on these doors, trying to get in to the stores to buy their product. So I, you know, just reaffirmed to me, you know, this primary source. So I don't know, Melissa, you're much more on top of this.
I am endlessly frustrated by this. And Ingrid had someone from the DCP present to her LPC, and she talked about, like, literally they can't do anything about these products, which is in contradiction to what Attorney General Tong is saying. So I don't even like that within the state, no one can agree on whether these products are falling under our cannabis laws. And then I asked her, which was really distressing, I said, well, what's the minimal purchase age for a CBD product? And she said, none. Anyone can buy a CBD product. So technically, Delta 8, you could walk in to be 12 years old and legally buy Delta 8, according to the letter of the law. And yeah, so the other thing that's, I think we need to talk about how we write our laws, because we need to stop defining the THCs, and we need to be talking about psychoactive products should not be sold in our gas stations.
Right.
And stop, because they just tweak a molecule, as Kathy mentioned. They tweak a molecule and you've got a slightly different product, just as strong. We did an environmental scan in Trumbull, just in our gas stations. We didn't even hit the vape shop, and thousands of these products, and some of them advertising 2,000 milligrams of THC per vape.
Oh my
Lord. And many of them have the California cannabis symbol on them. So, but they're not Delta 9, so they don't. So I did some digging, and the Farm Bill defines cannabis as Delta 9. Our bill in Connecticut, our law, the RERACA law, defines cannabis as anything with a cannabinoid. So we still need clarifications from the state powers.
Definitely.
But I suggest if you have not gone into a gas station in your community and looked at these products, you should do it straight away, because it's shocking.
Yeah.
And we're also, some of us who are in towns that have moratorium on cannabis sales, we're all trying to figure out if there are moratoriums or bans, because I live in Westport, which has a ban, whether our bans or moratoriums cover these products. So we have to go look at the language of those laws, of those statutes, or our local statutes. It's complicated. I would love a session with Attorney General Tong about this. There is also a mechanism through his website to file a complaint about these businesses. So Kathy, I took pictures at ours and I submitted complaints about our businesses that I thought were most egregious.
Yeah, so he's gonna, what I didn't realize, so they're following through with civil lawsuits, and the local police are following through with the criminal piece. But the other thing, as a local coalition, our next meeting, we did have somebody from DCP, because we wanted everybody to understand the regs around the cannabis retailers, but our next meeting, Daniela and Katrina, I think are on there, are going to present a map of all the stores, because it's the content within the stores, but it's also the number of stores that have come up. And as a local coalition, a couple of years ago, we had a meeting with zoning, but I really do think zoning is another piece of this in terms of how many have shown up. I don't know if other communities have noticed that, but they're just popping up everywhere. It
Well,
feels like.
we have 24 in Fairfield.
Right.
And I would say 6 of those 24 are selling the Delta 8, Delta 10, the modified CBD. And we've got one gas station that is selling more than 10 well, I guess it is 10 milligrams of THC. Star Gas Station on the corner of Jennings and Black Rock Turnpike.
Yeah.
So there's your gas and grass, right?
I don't know if Margaret's still on here, but one word of caution is in Westport, we discovered businesses selling THC products that were not tobacco retailers. So a yoga shop. So they're not licensed by the state to sell tobacco, but they were selling Delta. They actually, I think, were selling Delta 9.
Okay.
So you can't even just use your list of state licensed tobacco vape retailers.
Right.
And the CBD stores don't need a license. So you got to check for your CBD stores as well.
Can I mention that just the importance of this type of data and these numbers, because this is already, like Melissa, I'm so frustrated. Every time I think I got it, then there's more things to know. And it's like, if we are struggling to make informed decisions, how do we expect parents and youth and et cetera, et cetera. But when we were, when I was testifying in support of one of the cannabis bills on the regulations of cannabis, the legislators wanted numbers, they wanted data. And that was really difficult, one, to provide, but also two, when we were looking at regional and even statewide data from poison control, but also from emergency department admissions and demistreatment admissions, those numbers are, we kept hearing, well, we're concerned, but we don't actually see a significant increase, or it's too soon to say that there's a significant increase. And with demistreatment admissions, we saw those admissions decrease actually for people being admitted for cannabis use disorder. And so those are the numbers that they want, but those numbers are not supporting what we're seeing on the ground and locally. But the numbers of where are they selling, what are they selling, who are they selling to, I think that's most compelling. And actually Katrina and I were having a very interesting conversation, just brainstorming, why are treatment admission numbers going down when we would expect it to go up? At least that's what I would think. And we looked at the DSM criteria for cannabis use disorder, and you only need to meet 2 or something like that. And one of them was if you're taking risky behaviors obtaining cannabis, which it's legal now, so it's not risky. So maybe that could be a reason why we're seeing, just that admission, meeting that criteria. I don't know, but it's just so much that's going on that I think that those numbers that we're getting locally is just the most compelling and really important. So
I had someone in my coalition talk about insurance coverage for cannabis use disorder, and that there's a disparity between cannabis use disorder treatment as like insurance company, and I don't, this isn't my area of expertise, compared to how it's treated by insurance companies compared to other substances. So I wonder if there's a tendency to code things based on what insurance will cover better, if there's co-occurring disorders. So I think some clarity on that might be helpful.
Alyssa, I just want to go back to something you said just for clarification. So for these Delta 8, Delta 10 products, there's no age restriction on the purchase?
If it's a CBD derived product, there is, according to the DCP person who spoke at the Stanford LPC, there is no age because we don't have a statute for those.
Yeah. And thanks for bringing that up, Melissa, because we had some follow-up questions. Her name is Diana Shaw, and I will send you her presentation or whatever, but she was great. But we had different questions, and I can send her a quick question on that one, because you're right, it was, yeah, that kind of is like, what, you know, quite surprised with that.
And
There's also
Yeah.
one of the laws that's in the, one of the bills up at the legislature right now would limit, the one that restricts like that, and I haven't seen the latest version, but one of the elements was restricting gas stations from being able to sell any THC products.
Mm.
So we should definitely keep an eye on that. I don't, and that law, that bill was like under negotiation. So I haven't seen what stayed and what got tossed out.
They're selling plenty of CBD products, that I can assure you, and it's always under the guise of, you know, relaxation and things like that. Another quick question of clarification, and you may know this. Is there a difference between CBD derived and hemp derived? Because you'll see that mention on products.
I don't believe so, because CBD is derived from hemp.
Right. I just, yeah.
So the hemp plant is anything that has less than 0.3% delta 9 THC.
Right.
Yeah.
But then these are all synthetic. These aren't plant. I mean, now we're not even really talking about plants. We're talking chemicals.
So, Daniela or Melissa, who's ever on this group, can we, if we see products being sold in something other than sort of a gas station, a different type of location, because many of us are trying to get a handle on where it's happening in our communities, can we just email you so that you can kind of collect? Like, for example, I didn't know Melissa being sold in yoga or places like that. You know, so
well, I think part of the interesting is like those businesses wouldn't have gotten Attorney Tong's letter. Like
that's right.
He sent a letter just to the tobacco retailers,
right,
in the state. So these other businesses may just, I mean, if they're reading the newspaper, they should be starting to see some of these busts, but they may not know that they are selling a product that the Attorney General has deemed as illegal. So it may just be an a different kind of environmental scan,
right,
and a different kind of education.
Right. For us on our end, like, and I definitely find in a place like Stamford larger, it's just now I can put, oh, yoga studios just on the radar, you know, so it's not even realizing.
CBD stores, because some stores did open that were selling CBD. I know New Canaan had one, but I think it closed. We had one that closed.
Yeah.
The other thing I wanted to bring to people's attention is the normalization of seeing hookahs and marijuana, cannabis wraps in little community markets and grocery stores. I was really dismayed at the, you know, Brooklawn Grill and Deli or whatever it's called, right? A little community market. You walk in and there's this huge display of hookahs. Same place where you can get your sandwich and chips, right? And so I think that too is kind of normalizing the cannabis environment, and I'm concerned about that, right? Because kids see that, just like we have the tobacco products put behind the counter. I just feel like papers, you know.
Are the hookahs behind the counter? Because they should be, like anything that's, so then they're breaking. I mean, not that anyone's enforcing any of that, but they're breaking the Connecticut law that states that all smoking accessories need to be behind the counter and not self-serve.
We've got, you walk into some of these stores and they have their own little display off to the side. The other is Kratom, and that's not a CBD, hemp, or THC cannabinoid. It's not a cannabinoid, but it is a psychoactive plant that has different kinds of properties, but also, you know, is psychoactive too. And that's there's plenty of that in Fairfield as well. So, you know, if we don't need, my argument here is like, we don't need to have commercial cannabis THC stores in Fairfield, because if people really want to get high, there is plenty out there already that they can get their hands on to do it.
You smell it everywhere you go. I don't know. I've been smelling it everywhere, but I will just tell you in Greenwich, there's a convenience store on Greenwich Avenue, and they had in their window a display of all these like hookahs and all these smoking materials. And, Greenwich Avenue, the kids are up and down that avenue all the time. So I actually had one of our coalition members saw it and went in and complained to the manager. And then when she walked back down the avenue later, it was gone. They took it out of the window display. So, I think having educated community members and coalition members who are willing to speak up sometimes does help. So, I mean, it's not going to solve the whole problem, but at least the visibility was less. So that was good.
So Melissa, is there statute language about having hookahs behind the counter?
There's statute language that all smoking accessories, it was with the Tobacco 21, they required that all smoking accessories, all smoking products, nicotine products, tobacco products need to be, they can't be self-serve. They have to be, I forget the language, it's like shop assisted. Like you have to ask for it, or it has to be locked up. Because I call that a smoking accessory.
Oh, yeah. Oh, well, then there's Eureka on Black Rock Turnpike. That is a hookah lounge. And it is, a lot of it is self-serve. They just have counter after counter or row
But
after
you
row.
probably, but I bet you're supposed to be 21 to be in there. And that's different.
Yeah, that would be different.
I think they said with like vape shops, like if you're a vape shop and you're supposed to be only 21 to be inside, there's some different rules. But for like gas stations, convenience stores, anywhere where the general public and young people can go in, you shouldn't have any of those things on the counter, in front of the counter. Everything should either be locked up or behind the counter.
So you do have to be 21 to go into a vape shop?
I believe so.
I didn't know that.
I believe so, unless someone can correct me.
Is there anything about smokable CBD? Because we have a place that sells like flower CBD, and I'm pretty sure they're just selling straight up weed.
Delta 9, yeah.
Is that just like a send a complaint in type of?
I would want to know what those products were, right? Like, I mean,
Some of them, a good, like on their website, it just straight up says THC.
I would complain.
Yeah. Okay.
Right? Can't hurt to.
Yeah, that's the
put it
other
on
thing.
people's radars.
That's a THC product, but how much THC is in it? And then it's a whole math calculation to figure out percentage, milligrams, this and that.
I wait.
Some of them basically straight up say, I could send you the website, but some of them say CBD, others say THC. One of them says like 15 milligrams of THC.
Yeah, the police noted it in the press conference, James, marijuana flowers as illegal, so.
I'm wondering, Daniela, if we could have someone either from, Consumer Protection or the AG's office. Obviously there's a lot of unknown, I think, among all of us that we'd like to be educated more and also be able to share what we're seeing in our communities with them. It would be great to have someone come to our next LPC meeting and talk to us, and we can tell them what we know about our community.
Absolutely. I think that would be a great idea.
Especially if we could include some of our coalition members.
Yes. All right. I'm looking at the time now, so I want to be respectful of everyone's time. Thank you so much for coming today. Please look out for the follow-up email. There will be a lot in there, so I apologize now, but all good stuff. Have a great weekend. I hope you can enjoy the weather today. Bye, everyone.